perhaps for even the rest of the season.
Yeah, the right-hander's on the DL with a rare condition normally only seen in motocross riders and distance runners. What?
Yeah.
Orthopedic surgeon Dr. Rick Lehman is here to explain what's going on there.
Is he doing this on the side, do you think?
No, I don't think so.
No, we won't put that in anybody's. But you said off camera that this is something usually reserved for the lower extremity, certainly not an arm or a shoulder.
Correct. What happens is as you use your leg or your arm, in this case, the muscle expands, and the muscle expands in a confined compartment, so there's no room for the muscle.
Kind of like a bursting balloon, right?
Correct.
Uh-huh.
But there's nowhere for the muscle to go because it's covered by a sheath called the fascia. So what happens is the muscle gets bigger and bigger, loses its blood supply, and you get pain. So when you go to start running, you're running, the muscle gets bigger. The muscle can't expand because there's nowhere for it to go. It loses its blood supply, and then it's very painful.
Well, get rid of the fascia.
That's the answer. You got it.
Is it really?
He's the doctor.
You know, do you want to come give us a hand today?
No, I'm going to faint at the sight of blood.
No, I mean, I mean, it says it could sideline him for the rest of the year. I mean, that's serious.
Well, the problem is you don't see it in throwers, and it probably does have something to do with his trauma last year. You know, he got hit, and it probably created some damage. And now the fascia isn't like it's supposed to be. It's probably a little scarred down, and now he's getting this pain.
So does it inflame, and then it goes back to its normal size, and it just gets bigger when he's working out or when the muscle heats up?
Well, when he throws, it gets bigger.
Yeah.
And then what happens is when he's done throwing, it kind of goes back. But when it's getting bigger and bigger and bigger, there's nowhere for the blood to get into the muscle,
Ouch.
and then he gets pain.
Oh,
the muscle basically dies.
Yeah.
Well, let's talk. There's little leagues, there's junior leagues, there's Legion ball, there's all kinds of sports teams going on right now. For the average athlete, the kids playing in the evenings, on the weekends, what can they do to prevent something like this?
Well, normally what you do is you stretch, you ice when you're done throwing, and it's pitch count. You got to make sure you're not overloading your forearm. But generally in a thrower, you're not going to see it. Now in a runner, you see it a lot, and that's when you have to stretch. You have to limit your miles.
Afterwards.
And you have to ice.
Yeah, a lot of people don't realize. I do a lot of running, and I actually have to buy a shoe a size larger because my foot actually gets bigger. And I'm wondering if that's the same kind of concept.
Same thing, and that's exactly right. All the muscle gets bigger and bigger and bigger as the blood gets in it, and then your foot gets bigger. Now when you're done, kind of decompresses.
Yeah.
You got it.
So it's a matter of maintaining it early, even when in youth sports, so you prevent injury later on.
Absolutely, and he's going to have the surgery, which he had to release the fascia, just like you said. Very good.
Nice, John.
And then the only containment is the skin. The fascia's not there, and then the skin's flexible, so it can get bigger and bigger and bigger.
Interesting. All right. Well, thanks, Doc. We appreciate you coming in today.
You think there's a future for me in the medical profession?
Well, we got a lot of patients today, so if you're bored.
Hey, you look like that guy on TV.
Dr.
Don't worry about a thing.
Dr. Birdsborn. Scary. Thanks, Doc. We appreciate you coming in today. It is 7:53.
scary.
Well, school is out for most Metro students, but it's